cosmetic dentistry is a very exciting topic for me. It changes people's lives. It gives new self-esteem to people. I see many patients that come in with very compromised smiles. It's affected their work, it's affected their relationships. Smiles in our society, it's not a right or wrong, but we place high value on a great smile. Let me tell you why my cosmetic sequence is different than most. I've done over 500 smile makeovers. I have done special schooling to really define what a great smile is. And the sequence from the first day that you come in, we take pictures of where you are now. We are able to go to the computer, work with you, and really decide what kind of smile you're looking for, and we do that with computer imaging first. Second, we take study models of your existing mouth, and then I go and I sit down in my own lab and create the smile that I believe that you're looking for, but we do it in wax. And it's a chance for you to see what a simulated smile in your mouth would be, both on a computer and with a wax up, we call. So before we even start, you have a very good idea of where we're going. This is about your smile, not about what I think your smile should be. I want you to get what you're looking for. And there's lots of parts to this cosmetic change that you're about to undertake. The most important part about my sequence is once we decide where we think we're going with your smile, both on the length and the shape of individual teeth and the overall arch form, when you come in on the appointment to start the treatment, I'm able to give you a temporary, we call it a temporary restoration. I call it the trial smile. We're going to give you that trial smile that you and I have already looked and created on the computer and on the study models. We're going to now put that in your mouth, and you're going to wear that for at least a week, maybe two, and you're going to come back on a second appointment, and we're going to sit down and talk about how you like your trial smile. And we're going to be able to see if the length is correct, if the width is correct, tooth by tooth, and look at the overall picture. I will not go to the final restorations until I'm sure that both the patient and myself are happy with where we're going. We don't want to just have you come back on a second appointment, have the laboratory decide in their mind what they think is the right look for your mouth. You and I are going to decide what the look is, and we're going to test drive it. Okay? You're going to come back after that week appointment, after you have your trial smile. You're going to bring me a list of what you like and what you don't like about this smile. I'm going to look at you with fresh eyes, no anesthetic in your lips, and I'm going to be able to see how you smile and how you talk and phonetically, what's going on. I want to be able to see exactly, if I'm happy with the length of the teeth that we've now selected. After we decide, you and I work through our list and we correct right on your temporary, we correct length issues, thickness issues, arch issues, whatever it is. Your list and my list will correct those issues. Then we take an impression of your temporary restoration, give that to the technician. Now the technician can rebuild the teeth individually because you and I have taken the time to figure out all the length and width and all the different contours of the tooth. There's no surprise when you come back for the final appointment to have your temporary removed and the new restorations placed. There's no surprise. We've already done our homework. Now it's all about color and the nuances of what we build into each tooth. There's a lot of artistry that goes into this. Probably one of the very most important parts of this process is that I've worked with my ceramist technician for now 12 years. He is a very important part of this equation because we have to, after we tell him what we want him to create, now it's all about his ability to build in the beautiful parts about making the translucency and the type of individual tooth that looks like a natural tooth. Almost all of the work that we do is without metal. So it's porcelain, and it allows the light to really come in and out of the tooth. When someone smiles, you want to have this very natural look. Some people like a really Hollywood smile, and some people want more of a natural, fresh, upgraded smile. We find that out about you. You get to pick what the color is. You get to pick what the, really what the final shape is. It's all about you. And me working with my ceramist, having him involved, it allows us to build something that is absolutely stunning.